This week on the BackTable podcast.
We ought to be thinking about what does it take to make America healthier? What should the system look like, taste like, feel like? And what do we need to put in place to make that a reality? Part of that is innovation and technology. Part of that is looking at how we educate physicians and making sure that we have a workforce that's sustainable and meets the needs of the future.
Hi, everyone. My name is Ruchika Talwar, and I'm a urologic oncologist in Nashville, Tennessee. Today, I'm really excited to be joined by Dr. Willie Underwood, a fellow urologist and president-elect of the American Medical Association. Willie, I am thrilled that we get to chat with you today. Why don't you tell the audience a little bit about yourself?
Well, first of all, thank you very much, for having me on the show. You and I have been friends for a few years, and the work you've done at the AMA has been amazing, coming up through residency, and now you're an attendee, and that's awesome. Well, especially as an oncologist myself, seeing you as an oncologist and being in this space, it's great.
Thanks, Willie.
Yeah, this is awesome. So you said that, Willie Underwood, I'm a board-certified urologist. As I briefly stated, I spent the majority of my career doing urologic oncology, also been involved in health services research, and a previous Robert Wood Johnson clinical scholar, has done NIH work, has a biotech company, the prostate cancer biomarker, has had the opportunity to do a lot of really cool things. I was previous on the Council on Legislation, then chair of the Council on Legislation, and then on the board of the AMA, then chair of the board of the AMA. And now, as you stated, I'm president-elect of our American Medical Association, which is quite an honor.
Yeah, I know we're thrilled to have a urologist representing us at the helm. And, you alluded to this. You and I have been together in this advocacy space for quite some time. In fact, I've obviously been a guest on this podcast and shared a bit about my advocacy journey. But before we dive into the AMA, I wanted you to share a little bit with the audience about what started your advocacy journey. Why did you initially, join the AMA? You outlined all your prior positions. What got you here?
So just briefly, I got involved in AMA as a resident. I received an award from the AMA, and actually the person who recommended me for the award is now the current CEO of the AMA, John White, and he was the chair of the Residence Fellows section at that time. So it was a leadership award and community service award sponsored by Glaxo. Glaxo Welcome. So it involved us getting invited to 2 AMA meetings, the annual meeting and the interim meeting. And my chairman allowed me to attend. And attending the AMA, I saw the excitement. I saw a bunch of physicians working together, students and residents, working together to try to make the healthcare system better, right? And I wanted to be a part of that. And ironically, I was given free admissions to the AMA, free membership to the AMA as a medical student, and I turned it down because I didn't believe that the AMA fit, my values, right? They had a history of not letting people like me in. And I decided that I would never, ever be associated with that organization. And now years later, I'm the president-elect. So what are we really doing, right? So we know that physicians face many, many challenges that interfere with patient care. And that's why the AMA is addressing these issues that are important to physicians, and we can focus on matters most, and that's our patients, right? That we have to be a shining light. We have to challenge the issues that physicians face, and we have to bring our healthcare system to a better place and make our nation better. Now, as a physician, I believe that that's our value, right? And when I saw that, I wanted to be a part of it. And that's what really brought me to the AMA. And for me, if I'm going to be a part, I don't like being a t-shirt wearer. So I said, let me be an active participant. And then the rest, I just contributed where I could, when I could. And now, I'm the president-elect.
A lot of physicians who hear about the American Medical Association, perhaps get their mailers, they often ask the question, the AMA is just an organization that's charging me dues. They're not doing anything for me. You talked about how the AMA is advancing the profession and patient care. Can you elaborate a bit more on what the AMA is actually doing?
All right. So some of our major pillars, and again, we multiple things from physician education to medical school and growth and empowerment and innovation to climate change issues around healthcare, to all kinds of things, right? But our major issues are reforming Medicare payment system, right? Reforming Medicare so that we can promote physician practices and ensure access to all, right? Fix prior authorizations so that when the physician sees a patient and says, listen, here's the test that you need, here's the drug that you need, here's the treatment that you need, that patient should not have to go through hoops to receive that treatment. That doesn't make any sense to anyone, right? Scope of practice issues. Listen, if you say to someone, look, you have an option of who's providing you care. Someone who went to college for 4 years, medical school for 4 years, did a minimum of 3 years. And for you and I, we did 8 years of training, right? To be able to do what we do or more. Or someone that did 6 months or a year, took a corresponding course over the internet. Who do you want managing your care? I believe most people would say they want the first one, that they want a physician who's highly well-trained, who's taking care of thousands of these issues that I have, and they're better to provide the care than someone who hasn't. I believe that, right? So scope of practice issues that threatens patient safety from our perspective, we deal with those, right? Reducing burnout. Look, we came into medicine because we love it, right? Because we want to help people. We want to help make people healthier, to live their best life. But yet we know 300 to 400 physicians commit suicide a year, right? That's it, suicide, death by suicide. And numerous more burnout. 60% of physicians feel in burnout. Also, nurses feel burnout as well. So we have to reduce that, right? Because that doesn't create a great healthcare system. Again, and then also, how do we make technology work for physicians? We talk about AI, right? Now, we have to make sure that this technology improves patients' outcomes, makes practices more efficient, make the viability of delivering healthcare work better. Those are the pillars of the major things that the AMA is working on right now. Plus all these other things that I also mentioned. Also, Medicaid is a major issue as well.
Mm-hmm. Listen, I don't think anyone is going to disagree with any of the priorities you've outlined. I think those are all major issues, but I'm going to push you even further. So that's what the AMA is. Those are the priorities that the AMA has set. But how does the organization actually help make any movement on those things? I think that's a big piece that doctors don't really understand.
Yes. All right. So we know, as you've been there and you have played a major role in this. So we have our 2 major meetings on twice a year, right? So we have it around November, which is the interim, and then the annual is in June. And in there, people bring policy forward, right? We call them resolutions. Hey, we believe that this will help. So they bring the resolutions forward. And then we debate those resolutions and we adopt or not, right? Those resolutions. Then we take those resolutions and say, okay, now that we have passed these things, and these are our policies, our principles, how do we turn those into action? Mostly legislative action to implement these things at the state and the federal level. At the state level, we work with our state specialty society, our state societies, and our specialty society. So like urology, we would be a part of this and working with multiple states, but we're a small group, right? So then let's say you're in Tennessee. So the Tennessee Medical Society, they're there, or the Medical Society of Tennessee, I think it is. So they're there and they're looking at issues at the state level with the AMA helping with the resources. And if it's a urologic issue, urology helping out, bringing a coalition together to deal with those sort of state level legislations. at the federal level, we're talking about broader legislation and stuff like that. So the Medical Society of New York wouldn't necessarily have a big place, a big footprint in DC, but the AMA does. And it will work with our 50 state societies, our 134 specialty societies or more, and come together and try to move legislation forward with our policy efforts, our advocacy efforts, our advocacy team and others advocacy teams to come together to say, hey, we believe that this is good for patients' care and physicians, and this is bad for patient care and physicians.
Yeah. And, I think what you're really underscoring there is this idea of strength in numbers. I think for me, that's always been really key, understanding why it's worth engaging with an organized medicine group like the American Medical Association. It's just because we are more likely to make some headway when we are standing together as the largest group of doctors united in America. And your point, I want to spend a little time on this. Your point about urologists being tapped in when it's something urology specific is true, but it's really difficult when, for example, we've seen legislation that perhaps presents barriers to care for pediatric urologists in certain states, right? It's a lot harder for just the urologist to have their voice heard because there's such a small group. A lot of people don't even know what urologists do. So on that note, I mentioned one example, pediatric urology legislation at the state level, but can you share with me some other examples of why specialty physicians, whether it's urologists or others, should be engaged with a broader group like the AMA?
So let's just look at, I'm going to pick two key major areas that have been in the media lately and will remain in the media for a while. Medicare and Medicaid. So Medicare is 57% of the reimbursements for adult urologists, those who take care of adults, right? It's 57%. So what happens in Medicare impacts us directly, significantly, but indirectly as well, because our state payers, our insurance payers say, hey, they base their payment based upon Medicare. And they say we pay 80% of Medicare, we pay 150% of Medicare, right? Now, urologists, there's only like 9,000 of us, okay, right? So fighting that, trying to move that forward will be very difficult for urology to do that alone. But collectively, as part of the process, as part of the team, we become an added value, especially if we have a strong PAC, especially we support the PAC from urology, and we support the PACs from AMA, and we support our state PACs, and they're all three very, very strong, then we can come together and get those things passed, right? So that's just adults. Medicaid significantly impacts pediatric care, which includes pediatric urology, pediatric surgery, pediatric everything. If it says peds in front of it, the majority of their reimbursement comes from Medicaid. Right? So now, when Medicaid goes down, that's a direct impact. But guess what? For everyone, Medicaid subsidizes hospitals, ICUs, trauma teams, labor and delivery teams, right? They subsidize those things, right? So therefore, you may be a urologist and you say, listen, I'm a stone person, I'm do female, none of that matters to me, but then all of a sudden I don't have an ICU and I don't understand why. All of a sudden we don't have a trauma team, I don't understand why. Oh, we don't have a labor and delivery team, I don't understand why. Why? Because of the significant impacts on Medicaid. So all these things sort of come together in a way that sometimes as physicians, we don't understand. So though you may think that it doesn't impact you directly, I would guarantee you that 99% of us, it impacts us indirectly.
Yeah. And the people making these decisions, a lot of times are not physicians. There are only a handful of physicians in Congress. So when these lawmakers are looking for experts to weigh in on legislation they may be considering or statements they may be taking in drafted bills. I mean, are they actually turning to the AMA? Is what's happening? Because it's a little difficult to understand that right now. When we read the news, we're seeing, slashing Medicaid, Medicare reimbursements still not keeping up with inflation, millions of Americans at risk for losing healthcare coverage. So tell me a little bit about that right now at a time where things are really tense and difficult. There's a lot of unknowns. What's the AMA doing for us?
So it's a give and take. Okay. So it's a two-part process. Yes. Our lobby team and others are, and I don't want to call them lobbyists or we think in a negative way. So let's just call it our advocacy team. Our advocacy team is engaged with legislators and regulators because previous policy that's been passed, how that's implemented is determined by the regulators, right? So we talk to them, we work with them, we give our insights and stuff like that, right? Trying to move things forward in a positive way. Now, having said that, we are only as strong as we are strong. Willie, what are you talking about? That sounds like nonsense, right? You're only as strong as you're strong. Like, what the heck of silliness is that? I thought you got 3 graduate degrees. I thought you were smarter than that, right? So what do you mean by that? What I mean by that is this, is that if our PACs are strong, if we're able to mobilize physicians, so they say how many members you have. If we're able to say we got 50%, 80% of the physician workforce, that's a different conversation if you have 20, 25%, right? If we have a PAC that's 300 million, 400 million, and urology has a $14 million PAC, and the state of Tennessee has a $15 million PAC, and so on, then we come together and we say we have the ability to utilize our resources in a way that will have a positive impact on society, but it may have a negative impact on you if you don't make decisions that have a positive impact on society. You get to decide, right? But we're mobilizing our resources in a way to improve the health outcomes of this nation. And part of that is assuring that we have a strong physician workforce. We have a strong training process for physicians, that we have a quality of life that decreases burnout, right? That no one should have to go through hoops to get the care that they need, right? These are the kind of things and we make sure that technology is being developed and innovations are being done in a way that improves health outcomes and not just create more burdens for our delivery system. Right. So we're only as strong as we're strong. So we want to be strong, then we got to come together to be strong.
Yeah. Yeah. Well, listen, you started off by saying at one point you did not relate with the AMA. The organization's values maybe didn't align with your values. And to be honest, I hear that a lot. Many people think that the AMA does not stand for them, does not represent them, does not represent their values. It goes on both sides. It's like some people say we've swung too far in one direction, others too far in the other. We can't ever strike that perfect balance. But I do often hear, the AMA doesn't speak for me. What's your take on that? And what's your message to people who are very skeptical?
So, so you think about it. I started out saying that it's no way I wanted my name associated with the organization, and I'm now the president-elect. So really what changed? What changed was that I got involved and I saw what I saw. And I became a part of something that I believe is greater than I, that's bigger than me, that's bigger than my ability to take out prostates or provide other urologic care. It gives me a real opportunity. But I had to see it for myself, right? I had to really understand really what we're doing. Now, am I going to agree with everything? I don't agree with everything my mother did. But however, I love my mother. And if you say something about my mother, I'll beat you to a pulp, right? Right? I love her. Is she perfect? No. So is the AMA perfect? No. Will there be times that there will be policies and things we support that you will disagree with? Yes. That I would disagree with? Yes. That other people will disagree with? Yes. But when we put the collective together, and we say, listen, let's take it through our process of debating the issue, analyzing it. And guess what? In the end, we're going to take a vote. And when the vote is cast, then we're going to move forward in that way. Wow.
Mhm.
What is that? Oh, that's a democracy, I think. Okay, so right. I mean, we're just had the democratic process here, and that's what we're going to do. Do democracies get it wrong sometime? Yes, they do. Do they correct it? Yes, they do. Right, because they figure it out. Ooh, that didn't give us the outcome we expected. Maybe we got to go in a different direction. Right. So when you look at it, if you say, look, I know you didn't support this. I know you supported that, and I don't really care about that, and I don't like that, this, that, and the other. But I do care if we have Medicaid or Medicare. So join us for that, right? Be a part of that. I do care if medical schools have the resources that they need, that we're evolving as a profession. I do care that it costs $500,000, $300,000, or $500,000 to be a physician. I think that's absurd. And they're working on that. Okay, great. Let's join for that. If I do think that we should have a strong NIH and a CDC, and we should fund research. Okay, great. Then you believe that, then do it for that. Because collectively, those are the things we're working on as well. But what often things that people see something they don't like and they hold on to it because they want to, because it makes it easy and convenient to justify sitting on the sideline or not getting involved or being angry about something. That truth of the matter is, years later, you may find that what you thought was right was actually not right.
Yeah, yeah. And, you're describing this process where people draft policies, the whole body of the AMA is voting on it. And I imagine that is like the key for why you need representation. But there's probably a big divide in the physicians of yesterday, or those who entered the field a long time ago, and the physicians of tomorrow. And like you, I started with my involvement in organized medicine as a medical student, continued as a trainee, and there was a big difference in what we were advocating for, I should say, what our priorities were, the type of policy we were bringing, and that other demographics within the organization are bringing. Often, those two are at odds. So tell me a little bit about how the organization reconciles like the different values between those groups, and how do we move forward at a time where it feels like a lot of people in the world just can't seem to come to an agreement?
So it's interesting, right? I'm going to answer this two ways. And I have two stories, right? So years ago, the medical students and the residents took up these priorities, and that people really thought this. I don't know why they're talking about that. That is so horrible. Why don't they just mind their own business? Why does no one really cares about that? And that was smoking on planes and in the workplace and seatbelts. Whoa. Now we're like, so you roll up, because you imagine we're in a hospital, people used to be smoking.
Yeah.
Right. Imagine you tried that today. People would be outraged. You see it. Matter of fact, people don't want to be around you if you smell like smoke.
Yeah.
Let alone you smoke in front of them.
Yeah.
Right. That's totally unacceptable. We would, if in the trauma time, I used to do trauma during my 2 years of surgery training. Could you imagine if someone came in and they weren't wearing a seatbelt, right? You'd be like, what your kid wasn't in a car seat? Like, that's another one.
Yeah,
Those
it's a
are the
big
things
public health priority. Yeah.
Correct. Right? Those are the things. So now we're looking at other issues and we're saying the same thing. I don't know what's wrong with you. Why are you thinking about that? You need to just sit over there and be quiet. Go read a medical book. Go learn how to do this procedure and leave it up to the adults that know more about medicine than you do.
Yeah.
Because what they're talking about today are things that will occur tomorrow, that will be in place tomorrow, and we will say, thank God for it.
Yeah. I mean, it's interesting highlighting that for the audience. Yeah, the seatbelts and the no smoking on airplanes in a hospital and a workplace. Wow, that was actually brought about by the medical students of the American Medical Association. Incredible. Incredible. I think it can be really difficult, right? I mean, it feels like people do not agree on anything. And so to envision a room full of doctors, from a pediatric, generalist to an orthopedic surgeon, all in one room, voting, sometimes at opposite ends of the spectrum on things, how do we like come to an agreement on things? I guess there is more consensus than meets the eye, huh, Willie?
Correct. So there's a lot of conversation. There's a lot of reaching agreements. There's a whole process there that works very fairly from my perspective. And we take a vote. And sometimes the vote is a difference between one and two people. And sometimes the vote is the difference between, 20% want one way and 80% want the other way, right? In the end, the outcome's the same.
Yeah.
And we value it the same. And we look at it and say, okay, great, the House has spoken, right? The die has been cast. We're going to move forward in this direction. Now, does that mean if I'm on the 20% that I'm not upset by that? And do I disagree with that? Yes. But being a part of the 20% means that I'm a part of the democratic process. And once the House has spoken, we're going to move forward for the best interests of our profession and our patients. And the House has said it's this direction. If it's a difference between one vote or two votes, yeah, it's close. I mean, yes, we realize that society and the House is divided on this, but today, this is the direction we're going in. And let's go in there as a team, as together, and let's move this forward. Now, tomorrow, we may say no, right? Just like what happened when the AMA said, hey, no blacks allowed, no non-white to be a member of the AMA. That was voted on. They did it. They moved forward. Okay, then later, they said, ooh, that really wasn't a good idea.
Yeah.
Right? And let's change that.
Yeah.
Right? So yes. So I'm saying let's understand we're going to make mistakes, right? But to not be a part of the process, from my perspective, means you will never be heard. Right? You will never be listened to. I'd rather be the person in the room that says, let's turn right. And everybody says, no, we're going left. And then I could at least say I showed up, I gave my all. I told them that the exit door was right, but they decided to go left compared to I sat at home and I did nothing and they went left and it became disastrous.
Yeah.
Right.
Yeah. Well, along those lines, what do you think the future of the organization looks like? I mean, you talked about artificial intelligence. There's a lot of change happening in healthcare from a technological perspective. The way we see patients today, the way we operate, do procedures today is very different from even 5, 10, 20 years ago. So what is in the future from your perspective?
I can answer that question, one or two ways, right? So with all work, you're saying, will we evolve to play a different role in the system and in society, or what? Help me out with that.
I think the way the organization has taken a stand in the past has been pretty reactive, right?
I got it.
So I'm wondering, in the future, do you see us playing perhaps a more proactive role, particularly as it relates to like technology and how that's changing the way we practice medicine?
I got it. Perfect. Yes. Okay. I want to make sure I'm answering the question that's asked. Now, so here's the thing, and this is I think all these questions have been great. Hopefully you can tell I'm having fun answering them. But when we think about this, we have to play a more proactive role in everything. Okay. Now, there's one thing, other people put together policies and then we come in and say good or bad, right? And we fight it to try to make it better or whatever. Or we can say, listen, what does good look like for the future? What are we really creating? What is ideal? And I believe personally, and I believe there's members on our board that believe this and members of our house. As a matter of fact, I ran on this, is that we ought to be thinking about what does it take to make America healthier? What does it take? What should the system look like, taste like, feel like? And then what do we need to put in place to make that a reality? Part of that is innovation and technology. Part of that is looking at how we educate physicians and making sure that we have a workforce that's sustainable and meets the needs of the future, right? Some of that is looking at how patients interact with the system and how the system interacts with them. And not as patients, but as individuals, right? How do we create a better society? Now, as physicians, And I know so we look at it and go, Willie, that's not my issue, man. I just want to take out prostates. I like taking out kidneys, but I do want to be able to do that. And I do want to be able to do it better. So then you say, well, that may not be your cup of tea, but let's work together to allow the people who that is their cup of tea, help us come together to create the system that we truly want and not react to the system that other people think of and create. Because if we do that, then I guarantee you it's not going to work well for us. And guess what? Change is going to come. Right. And we will either be driving that change or we'll be ran over by the bus or train or hit by the freight train to change. And I prefer to be the engineer driving it compared to be the victim of it.
Yeah. Well, in a time where, like you said, change is constant, people are getting their health information from podcasts just like this one, perhaps doing their own research, consulting Google. Even physicians today are banding together in other ways, whether it's through the internet. We're seeing a lot of chatter on social media. How does the AMA stay relevant in all of that? I mean, I just think there's a lot of noise out there.
So first, I want to go back to a previous thought that I should have said sooner. So we have Health 2047, which is a innovation technology incubator to try to contribute to the growth of healthcare innovation. Right, that's the AMA. It's a subsidiary company, and they from separate from the AMA, but is a subsidiary. Right, so we actually have that. So that's one aspect of it. Getting ahead of information and technology. We're doing what we're doing here. Right, we're saying, listen, we're going to be out there and we're going to talk to and receive information from the universe. And the universe in this place are the patients and societies of the United States. And we're going to figure out how to understand what the needs are and begin to put things in place that meet those needs. Also, we also have an international group, right? The World Medical Association, which our presidents are part of, and the head of the council for the World Medical Organization is Jack Resnick, who was one of the previous past presidents of the AMA. So through there, we work globally and know what's going on internationally around healthcare innovation, healthcare delivery, healthcare barriers, healthcare burdens, healthcare successes. So which puts us in a position to say, hey, let's think about this and let's broaden our horizons, broaden the way we think, narrow our blind spots, and create a system that actually works.
Yeah. I think, that was really why I got involved in organized medicine from the get-go, is that I recognized that it was difficult to push a mountain alone. You really need help. You really need to unite, and you really need to get others to join the cause. I'm always listening to folks who are still struggling with this idea of the why. And so as we start to wrap up here, I really want you to give me your why. If you're talking to, a urologist out there who's saying, Willie, I just want to be able to see my patients, provide care. There's a shortage of urologists. I need to just make sure my patients are well taken care of. I don't have any more bandwidth. I can't dedicate more time to all of this. Why should they care? Why should they join the AMA?
So I'm going to speak to that physician, to that urologist who actually said, 'cause I hear that as well. Look, all I really want to be able to do is do this thing that I do. And then I say to them, my job is to help you do the thing that you do and make sure that you have the resources and barriers are removed, right? The resources to allow you to do it and remove barriers that prevent you from doing what you do best. But to do that, we need you to be a member and we need you to contribute in one or two ways or three ways. You and I do both, right? One way is that you just join as a member, right? You're a part, okay? And that means that you give your dues and you give to the PAC, okay, right? The other way is that you're an active participant at the specialty level, state level, or national level. That means specialty society, state societies, county societies, and you contribute if and will you can, right? And if you can't do that, so we do both, right? We're in there this way. But if you can't do that, the minimum cost is dues and supporting the PAC, right? So when I say the PAC, this is what I mean. If every physician, and there's 1.2 million of us, gave $1,500 to the PAC, $1,000 to the AMA PAC, which is the largest, biggest PAC, $250 to your specialty, and $250 to your state. That would give us the resources to be able to move any legislation forward. Mm-hmm. That's a minimal, right? Mm-hmm. And I'm a member, right?
Yeah.
Now, if you say, well, okay, Willie, I did that, but I don't really like the direction it's going in, then you become an active participant and you bring your ideas and thoughts to the table to be discussed and considered. Now, here's the interesting thing. You will also learn in the process that maybe what you think is wrong is right, and we may learn from you what we think is right is wrong. That allows us to be able, because it's an open-minded discussion process. If you're narrow-minded, then you contribute to nothing but narrowness. You just make things more narrow. But if you're open-minded, you broaden the horizons of everyone around you, right? So that's what we sort of want. So yes, I want you to be able to take out prostates. Yes, I want you to be able to take out, to treat, pediatric kids, with pediatric urologic problems, right? Reflux or whatever. I want you to be able to do that. So help us help you to be able to do that. Again, join, contribute to the PAC, and if you can, be an active participant.
Yeah. This idea of contributing to a PAC comes up a lot. And it's amazing. In medicine, there's just not as much of a momentum of folks donating to the PAC. But tell me, in your experience, from what I understand, the PAC for the lawyers is very robust. The PAC for other industries, it's incredible. Why do you think it is that physicians run behind in understanding the importance of donating to, and let me be clear, PAC is a political action committee that collects money to help donate to candidates who align with that action committee's specific priorities or legislative causes.
So I've never understood why physicians don't contribute, right? That's just sort of baffling to me. And I think maybe some of it is like, oh, I do that. I feel as though that I'm working only in my best interest, this, that, and the other, and it would be I don't know. Some of it it's not rational to me at all, right? Yeah. But this is what I do know. If you want what you need to be able to do what you do, then you have to put up. It's just that simple. Now, if you don't want to put up, then guess what? Shut up, okay, right? Shut up. If you're not contributing, then you have nothing to say, right? I get it. I'm not trying to be mean so then I'm like, well, come on, join me. I've done this. I've been in the room. People say, they made you did this. I said, okay, great. We're going to bring 10,000 doctors to the Hill. Sign up so you can come. Oh, no, I'm too busy. Oh, hey, dude, you just spent 20 minutes whining to me about this and that. But I say, show up and come with me and stand next to me. Nah, I'm not going to do that. So then my response is then shut up then, right? I don't know what else to say, right? If you want, I'm willing to fight for you. Yeah. But I need to know that you're standing behind me.
Yeah.
Right? I can be the person that you say, that Underwood guy, he's such a whatever. And I say, yep, but tell you what we're going to do. We're going to move this policy forward because it's in the best interest of our profession and our patients. Mm-hmm. And our patients are in the best interest of our profession.
Yeah.
Right. Yeah. So we're going to move this forward. And the options are, we move it forward. We like you to be in a seat that helps us move this forward. But if you choose not to be in that seat, we will help kick you out of it. Right. right? And the only way you can do that is to have strong PACs and to have strong memberships and to have active physicians involved and be able to come and contribute. Other than that, these things are just a dream and a fantasy. But once we bring those things together, we'll be able to do it. And I believe we have great policy. And I believe 99% of physicians agree with 99% of what we do and what we believe in. And but yet they focus on the, on the 0.1% that they don't like, or the 1% they don't like. And instead of recognizing that 99% of it we agree with, and then let's all come together and focus on what we agree with and what we need. And let's try to make our profession stronger, to make our patients' outcomes better. And by making our patients' outcomes better, we make our profession stronger.
Yeah. Well, Willie, I have to say, I mean, I'm just thrilled we have a urologist up there at the helm fighting for us. Thank you for always pushing the field forward. I was really thrilled to be able to share some of your expertise with our audience today. And we appreciate your time. Any parting words?
Well, thank you. I mean, I think the work you're doing here is awesome. And we need more of us to do this kind of work. And we need to participate more in this and support this podcast, right? Because these are the ways that we get information out there and become a part of our universe. And our universe is making sure that we have a great profession, that we have great patients' outcomes. So thank you. And thank you for allowing to participate. And most of all, thank you for showing up, contributing, being there, making this work. I'm so proud of you, and I'm honored to know you and honored to be a part of this program, right?
Thanks so much, Willie. For me, it really does help fight some of that burnout you alluded to. Like it's frustrating to work in a system where you feel like you can't really make change. And I've said this before, but I think united, we have our best shot. So it's really great to be able to band together. To our audience, I hope that you learned just as much from Willie in this short time that I have learned from him over the years. Thanks so much for listening.
All right, guys, thanks so much for listening. If you haven't already, be sure to follow and subscribe and rate us 5 stars. Also, share with a friend. If you do, who knows, there might be a BackTable hoodie in your future. If you have questions or comments, DM us. We're @_BackTableIND on Instagram, LinkedIn, X, TikTok, and Blue Sky. BackTable is hosted and produced by myself, Anish Parikh,
and Ruchika Talwar.
Our production team is led by Kieran Gannon,
Aaron Bowles,
Gabe DeGrazio,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Ann Dang.
Administrative support provided by Judy Dela Cruz.
Thanks again, and we'll see you next time.